Hello everyone, this is Delbert. I'm on my fourth treatment. This is day number 43 of my 6 months of dealing with this cancer junk. I had my 4 or 5 hours in the chemo center today where they pumped me full of Drano. I'm home with my lovely little purse that I get to carry around for 2 days and 2 nights. But Friday they'll take it off midday and I'll go through my, if you will, recovery, maybe a little bit of nausea or whatever roaming symptoms are going to come about on me during those days, because for the last 3 sessions, the symptoms or the side effects have been different. You know, first 2 weeks, it was one set of side effects. The next two, oh wow, got a whole new one. Then the last 2 weeks, I had a whole new set. Probably the only side effect that I can pretty much set a clock by is somewhere in day 1 or 2 after the pump comes off, I have this massive need to go to the restroom, and it's just like, run to the commode, do what you got to do. Okay, feeling better, let's take a few steps and get away from it. Oh, nope, run right back. That happens for about 2 hours. And it's probably the most challenging of the side effects. In the past, I've had the nerve pain to cold in my mouth. That was really fun. I've had the jaw pain when I eat. I'm not having that today, but I have had it for the past 2 cycles. I didn't have it on the first one either. Noticed a little bit of cold sensitivity in my hand when I did something stupid like get food out of the freezer. Probably shouldn't do that. You know, they warn you that you're going to have these side effects, and then you go and do stupid things. The last 2 weeks, while I was on treatment, I had a paralysis in my right hand. What a place to get paralysis. Come on. But where I noticed it is when I went to grab my mouse on the computer, and all of a sudden the hand didn't want to do what I wanted it to do. It only lasted for about a half hour or something. But of course it scared me. It was the first time feeling it. And I was like, oh my gosh, is this going to be long term or is this going to be permanent? I don't know that I can remember that. I don't know that I like that side effect. Tonight, while I'm on the pump, same situation. I go to use my computer, and just the left side of my hand, all of a sudden I went to click down on the mouse, and my finger said no. I was like, what? So, in any case, I was able to fight through it. It's just a new challenge. It's gone. 5 minutes later, it was fine, so it was very, very momentary. The other side effect that I'm finding that's giving me a little bit of pause is over the last few weeks, maybe 3 to 4 weeks, 2 cycles, I've gotten a toothache pain at the exact same tooth level, upper and lower jaw. I don't believe it's related to dental work. It may be related to the sinus problems that accompany this this drug, this Folfox 6 that I'm on. But again, it's about a half hour, enough to convince me maybe I do need to see a dentist, and then it goes away and I don't have it for days. A very unusual side effect that I'm feeling or that I'm seeing is that my sinuses, very, very dry. We're in the middle of the desert. I'm in Las Vegas. So that sinus problem that creates what I would call crusty. Some crusty bits in your nose that you want to blow out and get rid of. But when I do have mucus in my nose and I blow my nose, I'm finding that ugly mucus to be completely saturated in blood. First couple of times, it's like, uh-oh, should this be happening? But I've noticed that for the duration, for the whole time I've been on this, when I have a sinus problem, I blow my nose, one of the side effects that I'm getting all the time now is a runny nose. Excuse me. But I've only had a nose bleed when a piece of that dry matter breaks off. And I've only had it twice I'm on my 4th treatment. But every single time some wet mucus matter comes out, it's just totally saturated in blood. And that gives me a little bit of concern. We talked to the doctor about it today. The doctor said not really to put a lot of worry into it. All my stats are coming out clean. Says I'm healthy as a horse. I'm still eating like a horse. Nancy can't keep enough food around me. I can't imagine what our food bill is with all the crap I eat. My insurance company sent me a letter talking about liver disease and because of some of the medicines I'm on, and that I should be checked for hepatitis B, I think they said. We showed it to the doctor. He said, they're watching the blood counts, not really a big deal. All the stats are coming out great. I don't know if he's going to run a test for it or if I'm going to have to go get a test for it later. But there's nothing that concerns him. At least that's what he led me to believe. But again, day 43, I'm doing great. We're going to stick with the idea that this is mind over matter and that I care to complete this 6 months. I care to get back on my normal life, traveling around this country, chasing women, drinking all the alcohol I can find. Actually, I don't drink that much. Maybe once or twice a week. But I still want to be able to do it when I want to be able to do it. We're going to make it. We're a third of the way through. 2 more treatments, I'll be halfway through. I'm on a milestone from last week because I was down below 10. Now I'm at a third. 2 more treatments after this one, I'll be halfway. Anytime anybody gets halfway, man, the rest of it's downhill. I'll report to you over the next couple of days if I get any new symptoms, how I'm feeling, things like that. I hope these videos are helping anybody else that has to go through this. And talk to you in a couple of days.